There are some children who have holes in their heart. They're born this way, we need to help them. And all these children cannot run or play. Some will lose lives, we need to prevent that. All these children are falling down, and we can help pick them up again. And all their families are crying for help, and we will help pick them up again. They will survive, they will thrive, because every child deserves the gift of life. Because every child deserves the gift of life.
This hospital is under God's power, and God knows everything. I believe that all doctors will do it, and God help them to keep my child alive.
And I never expected it to be. The whole process was simple, but the outcome benefits everyone, not just the child itself, but the family.
What they need is a surgery, so they can live a life like you and me. We can help them fill this hole. Just take a stand so they're not alone. Take a stand. Save a life. They will survive. They will thrive. Because every child deserves a gift of Because every child deserves a gift of Sanjeevani Hospital will help save lives. Free heart surgeries will keep these kids alive. Sanjeevani Medical, the beacon of life, answering prayers day and night. They will survive. They will thrive. Because every child deserves the gift of life. Because every child deserves the gift of
Thank you very much. The champion, a global humanitarian, global social service leader, and founder of Sanjeevani Hospital globally and in Fiji. Welcome again. Sadhguru Sri Madhusudan Sai. A very warm welcome back to Fiji to you. Mr. Isaac Tigret, founder of the Hard Rock Cafe. Mr. Narasimha Murthy, Chancellor of Sri Sathya Sai University of Human Excellence. The 23-member team of surgeons, doctors, and specialists from the United States of America and Australia. My brother Mahendra Tapu and Mrs. Maya Tapu, Chairman and founding trustees of Sai Prema Foundation. Mr. Sumit Tapu, Chairman of Sai Sanjeevani Children's Hospital, Dr. Krupali Tapu, Director of Sai Sanjeevani Children's Hospital, and compere and master of ceremonies tonight, trustees and staff of Sai Prema Foundation and Children's Hospital, distinguished guests, ladies and gentlemen. That has taken up almost 1/4 of the time I've been allocated tonight. A very good evening to you all. I acknowledge the traditional owners of the land we stand on, the people of Nandonumai, Wanaturanati Suva, and pay our respects to the chiefs, past and present, as well as emerging leaders and members of the Vanua of Nandonumai, who may be present here this evening. We acknowledge their role in caring for the Vanua. I join you this evening to mark the 2nd anniversary of Sai Sanjeevani Children's Hospital and Gift of Life ceremony. All the children who have had life-saving heart surgeries at the hospital were suffering from congenital heart disease, which I've been told, I'm no expert, I've been told is a birth defect. Since the inception of the Gift of Life program by Sai Prema Foundation, 260 children have received free life-saving heart surgeries. I do not know what the percentage you found in your screening of those who may need treatment to the total number of children that you screen. But at home, I have 5 great-grandchildren, and one of them was undergoing periodic injections from the hospital. That's 1 out of 5 in one family. So I urge us all, please send our children, grandchildren, great-grandchildren along for the free screening that's offered here. In addition to the children of Fiji, the hospital has opened its doors to children from our Pacific Island neighbors. Within the first year, the hospital has fulfilled its promise to become the hub of pediatric cardiac care for the Pacific region. This is indeed a proud moment for Fiji. I'm particularly pleased that we are also holding the Gift of Life ceremony this evening. Tonight I should have been at the closing of the parliamentarians workshop at the Intercontinental Hotel or Resort in the West. But I had to ask for leave early to be here tonight and to attend to the very unkind invitation from my friend, the High Commissioners of Australia and New Zealand, to be up at 4 and be on parade at 5 and celebrate tomorrow Anzac Day. But this ceremony tonight honors the parents, children who have received the gift of life via life-saving heart surgery from Sai Sanjeevani Hospital. The ceremony also honors the incredible surgical teams for their efforts to save the lives of these precious children. The Sai Sanjeevani Hospital is truly a godsend for Fiji and the region. While government aims to provide quality, affordable, and efficient health services for all, it is like a dream given our economic challenges. The establishment of the incredible success of the Sai Sanjeevani Hospital is like an anomaly or a fantastic, hard-to-believe tale until you look at the founding trustees and the directors and their incredible vision and commitment to make this dream come true. The People's Coalition government have the same drive and determination to improve our health services in the country. Soon we will see a new 100-bed hospital built in Nasinu by the government of India to become a reality pretty soon. The team from the Indian government presented their vision and the drawings to Cabinet 2 weeks ago. I am confident that this will come to fruition very soon to increase access to life-saving cardiac surgery for adults in Fiji and the region. Tonight is also a momentous occasion as we have here in Fiji the inspiration and the example for this hospital. I want to welcome the very special person on behalf of the government and the people of Fiji. And let us welcome Sadhguru. We're grateful to him for being the inspiration behind the hospital and various humanitarian projects and initiatives in Fiji. He spearheads a unique global mission across 32 countries. Since 2011, he has established institutes of excellence in education, healthcare, nutrition, and spirituality across the world. It includes 27 educational campuses, a university in South India, and 3 institutions abroad in Nigeria, in Laos, and in Australia, which are providing free, values-based education to over 5,000 boys and girls. In Mudanhalli, near Bangalore, very close to the school where I went to in 1979, which is also the epicenter for all global service activities, a totally free 360-bed multi-speciality hospital treats over 1,200 patients every day. $1,200 every day. This hospital is also a teaching hospital for the world's first free medical university, the Sri Madhusudan Sai Institute of Medical Sciences and Research. Guided by the vision in rural for rural. That sounds like something we understand, eh? Rural for rural. This first of its kind medical college was inaugurated by the Honorable Prime Minister, Sri Narendra Modi ji, on the 25th of March, 2023. And we wish him well in the elections ongoing now in India. And the free medical college will train doctors with who will dedicate themselves to serve the underserved, particularly in rural India, where their needs are the highest. Today, 10 specialty hospitals in India, 3 hospitals abroad, Fiji, Sri Lanka, and Nigeria, are providing free health care. Over 25,000 free pediatric cardiac surgeries have been done successfully. The Sri Satya Sai Sanjeevani pediatric cardiac hospitals are the world's largest chain of children's heart care hospitals that do not have billing counters. Can you imagine going into anything for service that doesn't have a billing desk? A morning nutrition program nourishes over 1.2 million school children or school-going children every single day in India and across 5 countries. All services are offered absolutely free of cost to all without any discrimination. 12 centers for human development in 11 countries have been established to the welfare of humanity. Please allow me to elaborate on the Sai Prema Foundation. You heard some of it, earlier in the evening. The foundation is registered as a non-profit charitable organization in Fiji, founded in 2016 to serve the poor and underprivileged people of Fiji. It has established itself as a leading NGO in Fiji and the region, I believe. The foundation has built a state-of-the-art medical center as a general outpatient facility with emphasis on mother and child care. It has served in excess of 25,000 Fijians free of charge. The foundation has established a state-of-the-art specialist children's heart screening center with the latest 4D technology to diagnose children suffering from heart diseases. So far, more than 16,000 heart screenings have been conducted on children free of charge through the center and through the outreach screenings in rural Fiji. The foundation has established a specialist children's heart hospital recognized by internationally renowned pediatric cardiac surgeons as a facility on par with hospitals in the United States, in Europe, or any other highly developed countries in the world. This 25 million state-of-the-art pediatric cardiac super specialty facility has been successfully treating children born with congenital heart diseases over the last 2 years. Prior to the opening of this hospital, there were no pediatric cardiac facilities available anywhere in Fiji or in the Pacific, and overseas treatment was unaffordable. I'm told that the cost of overseas treatment would be in excess of Fiji $100,000. All surgeries and treatments are completely free of cost. As a matter of great pride, that Fiji is the first nation in the Pacific and Oceania region to have such a hospital. Don't thank me, thank them. This hospital is an answer to the prayers of thousands of mothers and families. Heart disease is the #1 killer among children, and its high prevalence rate is of great concern. There are hundreds of confirmed cases of heart disease diagnosed just through the Sanjeevani Children's Heart Screening Center. These numbers are staggering and, of course, very concerning. This is why the specialist hospital was built, and this is the largest investment in healthcare by an NGO in our nation's history. Despite the charitable nature of the project, the Sai Prema Foundation has created a world-class facility with the aim of providing the best possible surgery and treatment to the children of Fiji and the Pacific. The hospital houses state-of-the-art equipment for its operating theater, intensive care unit, preoperative and postoperative wards, and the hospital also includes a training center with technological capabilities for international video conferencing. When it was established, the vision for this children's hospital was to become the premier pediatric cardiac center for Fiji and the Pacific Island nations. I believe it has achieved that aim, and I offer warm congratulations to the trustees, the directors, the staff, and supporters of the foundation. I wish my audience during my political campaign were as receptive as you are. The children of our nation and the region deserve the very best treatment and a prosperous future, contributing towards the welfare of our nation and the welfare of the world. The foundation has also successfully trained a Fijian doctor in India in the specialist area of pediatric cardiology. I'm also pleased to note that the government contributed towards the operational expenses of the hospital via a grant. So thanks, DBM. Other work by the foundation. The Sai Prema Foundation has been serving the poor and underprivileged people of Fiji through various medical, education, and social services projects and initiatives. The foundation has also been the highest collector of blood over the years to support and supplement the National Blood Bank. In conclusion, ladies and gentlemen, I again commend the foundation which has built a hospital dedicated to saving the lives of children who live with congenital heart disease. And without good Fijians like Mahendra and Maya, Sumit and Krupali, we would not be here today to celebrate the 260 successful surgeries that have been carried out right here in Fiji, benefiting not only the children and their families of Fiji, but also the Pacific. What an achievement. On behalf of all who are here, we pray for blessing. God bless you all. Thank you very much.
Next, we have Ariella Buako, 8 months old, from the Solomon Islands. Mr. Robin and Mrs. Rani Swami.